Good evening. This is Dr. McDaniel. I'm going to try to hold the camera up really close because I know it's fairly dark out here. I'm out on the roads traveling today, so I'm standing outside right now because my family's inside making a lot of noise. But as the title implied, I wrote the importance of breast cancer screening, and I wrote that for a couple of reasons. One, I get quite a few questions on when someone should start getting mammograms, when breast cancer evaluation should be done to obviously to detect potentially precancerous or early breast cancer changes, and how important is it to do the self-breast exams. Sorry. I'll start with how important it is to do the breast cancer exams, because a couple of years ago, I believe it was the American Cancer Association put out a bulletin that stated women should stop doing self-breast exams. And I've had several patients tell me that they thought we weren't supposed to do breast exams anymore. They thought breast exams were no longer recommended. So as I've stated before, one has to keep in mind public health announcements, which are looking at the forest, versus what I would call common sense, which is monitoring the trees. So societies like that are balancing the cost that the public has to put out and balancing how much money we put out as a public versus how much money is spent to prevent or to treat as early as possible a cancer for someone, which is breast cancer in this case. Society is going to have to make that balance where we're going to lose a few people to breast cancer in order to save billions of dollars to prevent one breast cancer. And that's really where that statement's coming from, that women should stop doing self-breast exams. Now, they're correct if you're looking at the eagle's eye view of the trees. They're correct about that because majority of lumps found by women on doing their own breast exams are benign. So we're not preventing cancer, we're just finding benign, non-cancerous lumps. And we spend a lot of money when women come in for a lump. Obviously, in advance, we don't know if that lump is benign or if it's cancerous. So a full evaluation is done whenever someone comes in with a lump that they are saying was never there. They find a lump, they have to see the doctor, either a gynecologist or their primary care doctor. That's a doctor's visit. Then they have to get an ultrasound or a sonogram. Sonogram or ultrasound is done to determine if that lump is liquid, which is a cyst, or if it's a solid tissue, which is a tumor. If it's a tumor, then they're going to need additional tests. That's going to be a mammogram to look at the background structure of the tissue. That background structure, mammogram is just an x-ray. And the x-ray is to determine if there are any tissue changes or structural changes that could indicate abnormal blood flow, because tumors that grow rapidly are usually cancers, and cancers always garner an increased blood supply. Okay. Fais ça encore une fois. Okay, that's called, what do they call that? They call that I forget what they call it when someone comes in the background. Anyways, one of my kids acting silly. So whenever a mammogram is done, it's looking for tissue changes which indicate abnormal blood supply. So it's a doctor's visit, it's a sonogram, a mammogram. Obviously the radiology doctors and the technicians have to get a piece of the money pie because they're doing work. People don't work for nothing now, they have to pay bills. And after that, if it's a tumor, more often than not, it's going to usually need tissue sampling. So that's going to be a needle aspiration to get a few cells to evaluate. That's going to be the procedure, pathology evaluation, or it's going to be a large biopsy, a core biopsy to get a chunk of the tissue, or sometimes it's going to be removing the whole thing. All of those are procedures and pathology evaluation. And then if the biopsy is not done, if it's really deemed that it's benign, it looks totally typical for a benign non-cancerous lesion, the radiology doctors is still going to want to look at it again in 6 months to make sure that it hasn't changed, because they could have made a mistake. It looked really, really, really benign, but then it turned out it wasn't really, really, really benign. So all of that, as you can imagine, is money, money, money. And as we say in medicine, it's an old adage, if you don't look for it, you won't find it. So the recommendation is for women to stop looking for lumps, because most of those lumps are benign, non-cancerous, and we're wasting a lot of money and resources just discovering that people don't have cancer. And they're right about that when you look at the big picture. The reason why I still recommend that women do self-breast exams is because you don't know in advance if you're going to be benign, if you're going to be in the cancer group. Now, the American Cancer Association, I believe they were the ones who stated also that the reason for also not doing the self-exams is because even the masses or the lumps that are cancerous could have been found at a later stage and would have had the same outcome. So what's the point in finding something early if you're not saving this person anything? So we're finding the breast cancers too early and we're treating them and preventing the spread, but had they been picked up on the routine scenario, which is the doctor doing the exam or getting your routine mammogram, it wouldn't have made a difference at the end of the day.